joining us for a briefing on Thursday, March 25th. We will hear from Governor Spencer Cox.
Ladies and gentlemen, it's great to see so many of you here today. Thank you for joining us. We're here in Spanish Fork in Utah County at what used to be a shop and now has become a lifesaver, as we come to one of our mass vaccination clinics here in the state. I want to thank the Utah County Health Department for making this happen. Commissioner Lee, it's great to have you here. Thank you. We appreciate all of our public officials that have worked so hard to get vaccines out. We're just overjoyed today, Abby and I, to be here with you. As you know, we will be getting our vaccines. We've had lots of opportunities to get the vaccines in the past couple of months, and much to the dismay of members of my staff and others, we've declined every opportunity. We wanted to do it the right way, and we wanted to make sure that we weren't getting ahead of in the line of anybody else, because in Utah, we made the determination, it was the right one, to focus on our most vulnerable first. And I'm not going to share the numbers. I'm going to let the Lieutenant Governor do that. But what I can say is that we've been incredibly successful here in Utah, as successful or more successful than any other state in vaccinating those over the age of 65 and those with the underlying comorbidities. And so yesterday was a really special day when finally we were able to open it up to everyone in Utah. Everyone wants a vaccine. As you can hear behind me, there are so many that are here. They're coming through every day, getting that vaccine, and making sure that we're saving lives and we continue to drive down the transmission of this virus. And so I'm not sure exactly what word I should use to describe how Abby and I are feeling today. I don't know that the words are adequate. We are excited. We're overjoyed. We're relieved. We're just more than anything else, more than any grateful as we reflect back on this past year and the miracle that is this vaccine. That we had a chance to study it all, everything that went into these different vaccines, really coming together, and the people that made it work, the science behind it, everything that had to line up just perfectly, and so many people that worked around the clock to get these in record time, ensuring that they're safe for everyone. And then now we see the practical results as our case numbers continue to come down. We have Dr. Angela Bender with us as well, which will talk more about that. We've seen a little bit of that over the past couple of weeks with our case numbers that came down nearly as quickly. And then this week we're seeing case numbers drop again precipitously, which is great news. And so we're very excited about that. Now, today we will be receiving, I believe it's the Pfizer vaccine. We had an opportunity, we could have gotten whatever vaccine we wanted. I was going to get the Johnson & Johnson vaccine because we were worried about Johnson & Johnson hesitancy. I wanted everyone to know that it is totally safe. It's a great one to get. But we haven't seen a problem in Utah with people wanting the Johnson & Johnson vaccine, and that's great news. And so we said, hey, whatever they give at that location, we'll take whatever it is, and round it as Pfizer is what we're giving at this location. So we encourage people again to get whatever the best vaccine for you is the vaccine that's available as soon as you can possibly get it. So don't worry about the brand of the vaccine. They are all incredibly effective and incredibly safe. And so we're excited to be getting more and more vaccine in our state. The Biden administration, the advice has let us know that we have more coming, especially the Johnson & Johnson vaccine. That's where we're seeing the biggest increase in production. That's the newest one. And we expect to be getting thousands and thousands of doses of Johnson & Johnson over the next week and the next week. So a surge in cases right now is avoidable. And we want to remind people that as restrictions lessen and change, we still ask them to please be careful. Again, get vaccinated. Make sure you get your second dose of the vaccination. Wear masks to keep you safe and keep other people think, until you're fully vaccinated. All of those things that you've been doing, we can keep doing because the end is so close and the end is in sight. Now, with that, I'm going to transition a little bit. We have there is one issue that I want to talk about, but many people may not be aware of. It's a sobering issue, but it's also a very positive issue. Now, unfortunately, as you know, we've had over 2,000 fatalities here in the state of Utah because of the coronavirus. As of today, as of today, 2,080,000 people lost their lives. FEMA has asked us to make this announcement because right now, with the passage of this latest bill, this pandemic relief bill, there is actually funeral assistance now available for families of loved ones who have passed away. So FEMA will be launching a program next month. I want to be clear, we don't have all of the details yet. The reason we're announcing this now is so that families can start to get their paperwork together so that when the details of the program are announced, that you will be ready to apply for that relief. This program will be launched next month will be aimed at helping the financial stress and burden caused by the virus. So under the Americans Act 2021, FEMA will provide financial assistance for COVID-19 related funeral expenses incurred after January 20th, 2020. So this is retroactive. And any families who lost families after January 20th of last year will be eligible. They will begin this funeral assistance in April. Right now, people who have COVID-19 funeral expenses are encouraged to keep and gather the following documentation. Eligibility for the program, the death must have occurred in the United States, and the death certificate must indicate that COVID-19 was an attributable cause of death. So you can the death was attributed to COVID-19, and you will need the beneficial death certificate as well as funeral expenses documents, and you can get those from the funeral home if you do not have those. And then proof of funds received from other sources to offset that. I believe the eligibility runs up to around $9,000 at the high end. But again, it depends on what the expenses were and if they were funded. Applications will be made directly to FEMA again starting in April. And in future press conferences, we will bring you announcements on how to make that happen. But right now, you can begin gathering that documentation. Now, with that, I just want to add on a transmission index. We've been keeping note. I'm pleased to announce that we have 2 counties in high, 23 in moderate, and 4 in low transmission, which means that we have a couple of counties that are moving into moderate this week, and those are Barfield, Caney, and Uinta counties. So that is good news for those counties. And with that, I'm happy to turn it over to the Lieutenant Governor for an update and announcement on the vaccinations and some other information. Lieutenant Governor.
Thank you, Governor. And I just want to welcome everyone to my hometown and the best city in the state of Utah, Spanish Fork. Really happy to be here and prayer for Utah County Department of Health, Commissioner Segovich, Commissioner Lee, and all the others who are here who made this happen. Thank you for that. I have a vaccine update that I want to give. So far, as of this morning, we have administered 1,232,991 doses of COVID-19. Those are shots in arms. That is first and second doses combined. That is an increase of 152,952 doses over last week, which is really impressive. Also, I want to talk about, the Governor mentioned this, the percentage of vulnerable population that have been vaccinated. And so those who are 65 years or older, 80% of them have received at least one dose. 80% of 65 plus have received at least one dose, and 57% of them have been fully vaccinated, which is also really incredible. And we want to really thank our local health departments and other partners for making that happen. It's been an incredible effort. Now, the first age-based eligible population we had was 70 plus. booster, and 83% of them have had at least one dose, and 67% of them have been fully vaccinated as of this morning, which we're really proud of, really great proud of. Now, this is the clearest path back to normal for all of us. And so we encourage everyone who is now eligible, and that's everyone over the age of 16, to go ahead and get your vaccine scheduled. It may take a little bit of time. You may have to wait a couple of weeks, but please don't hesitate. Don't wait. Try to get that scheduled as soon as you can, because that's the way we're going to get back to normal. And to make this easier on state employees, Governor Cox earlier this week actually authorized 2 hours of administrative leave for all state employees who are scheduled a COVID-19 vaccination. And we just want to express our support to our state employees and to the supervisors, and thank them for their willingness to be flexible and to provide that flexibility so that no member of Team Utah really is in a situation where they have to choose between getting a vaccine or doing their work assignments. We really care about each other. This is one way that we can show it, and we hope the private employers throughout the state, if they're not already doing so, will follow the lead and do that as well, provide flexibility for their employees so that they can get their shots. Really quick, and quick update on our vaccine distribution plan for equity. We want to make sure that vaccine administration in the state of Utah reflects our population, that we're not leaving anybody behind. This pandemic has affected everyone. It's affected some people more than others, and we want to make sure that just because a vaccine is available, just because someone is eligible, doesn't mean that they're actually the vaccines are accessible to them. They have that accessibility, so we're really focusing on that. Last Friday, I visited the George Wayland Veterans Home in Ogden. Now, this was the first of many mobile vaccination clinics that we had that the state's deploying to help vaccinate residents and staff at long-term care facilities. Now, early on, we did, the federal government did provide vaccines for long-term care facilities. But since then, since moved in, there are new residents, there are new staff that haven't had the ability. So we're making sure we're focusing on those long-term care facilities so that these residents or those who didn't have an opportunity last time could get vaccinated. And that's very important to us. We're also working with home health partners to provide mobile vaccination clinics to those who are in need. And we're going to expand this service to other congregate care settings in the coming weeks, to include behavioral or substance use treatment facilities, group homes, assisted living centers. And in addition to the congregate care settings, local health departments are also working with their communities to set up smaller vaccination clinics. And I've got just a few examples of where this has happened recently and where it's going to happen in the future. Last week, the Utah Muslim Civic League worked with Salt Lake County Health to set up a clinic at Los Angeles. Also last week, Southwest Health Department partnered with the Southern Utah Pacific Islander Coalition to hold a clinic in St. George, where they were able to vaccinate 280 community members. And I heard that was actually a really great event. There was a lot of camaraderie and positive feelings there. The Bear River Health Department this week sent a mobile clinic out to Park Valley in Fox Elder County in the far northwest corner of our state. And they had enough vaccines that day to get everyone in that town who wanted a vaccine, which was awesome. Tomorrow, Senator Mitt Romney and I are actually going to be visiting a Spanish community clinic at a senior center in Davis County. And next week, I will be visiting a clinic in Duchesne County. We are really, really grateful for the many people who have worked so hard to make this possible. I know the governor's excited, and I can say, as his partner, that I'm really excited. Abby, our first lady, are getting our shots today. We will be there, I believe, when this era is over, when our governor is safe. We know that he is safe from this terrible virus that has affected so many of us in really long-lasting ways. Grateful for the hope that this provides. Thank you all so much. Okay, good morning. daily average of new cases is now at 419. This is down from 489 last week. Percent positivity is also decreasing. Person over person is now at 7.6% positivity, which is 8.4 last week. And test over test is now at 3.8, a decrease from 4.2 of last week. And our ICU utilization is continuing to decrease. Our referral ICUs are at about 72% utilization this week. Our cases are decreasing, and they're decreasing at a slower rate, like the governor mentioned. However, our leading indicator of percent positivity is continuing to decrease. So while that is still going down, it is great news, and that means that our cases have continued to follow, as will our hospitalizations and our deaths. So we need to continue with continue covering physical distance when we can, and stay home when we're sick, and of course get the vaccine when it's your turn, which now everyone 16 and older can sign up to do so. We're here at Utah County, one of their vaccination sites, and I can tell you it is so organized, well run, in addition. We've got Utah National Guard, Utah National officials, nurses, and other medical professionals all here to make sure that anyone who wants the COVID vaccine can get a vaccine. It's filled with hope and joy. And I had the opportunity to volunteer at the Sullivan County Vaccine site on Monday, and it's a similar experience. Our local health departments are really the reason that we've been able to quickly get shots in. So I really want to thank all of the public health professionals out there for continuously dedicating their time and energy to this effort. You are the reason we are pushing towards the end of this campaign. Thank you.
Thank you, Dr. Dunn, for that great report. And Deborah Henderson, thank you so much for your incredible work in helping to organize these vaccination efforts. I just again want to thank our public health professionals who are doing this as volunteers who are here, the National Guard. We've never done anything like this in this amount of time with this many people. And the energy we can feel here, as Dr. Dunn said, it's a vibe, it's a thing, and it's a good thing. And we need more of it, and we just so encourage you to get out and get your vaccine. With that, we have time for that questions. But I have to admit, I'm very anxious to have this part done. So we're happy to answer some questions. Okay, so the question was, if I could, for our Latino community, if I could share a few words in Spanish about how we're feeling about this opportunity to receive the vaccine. No sé cómo decirle muchos pensamientos extendidos sobre cómo estoy sentido ahorita, pero estoy bien animado y para tener la oportunidad de recibir este milagro. Y espero que todas las personas en nuestro estado que ellos pueden tomar esta oportunidad de guardar y salvar a su propia vida y las vidas de los demás. Es una medicina que nos puede ayudar a regresar al normal, más que nada. Eso es lo que queremos y esperamos que todos puedan tener eso. Gracias. Please go. Yeah, well, so again, given the trajectory that we're on right now, and that we're all changed, but given the trajectory that we're on right now, we anticipate that those health restrictions will all be gone before July 1st, certainly with the amount of vaccines and the rate of vaccination and the decline in case counts. We're on pace for that. We're very hopeful. We did have a meeting this past week with the White House and Dr. Fauci, and he was also very optimistic. He did say, of course, we're watching Europe. Europe has tended to be a little bit of a leading indicator in the United States when it comes to surges, and they're seeing plateaus in many countries, and they've seen increased cases in some of the areas. But there is something very different. There is something that is that our rate of vaccination is so much higher than theirs, and even if we do see an increase in cases, the fact that we have vaccinated so many of our most at-risk populations makes us even less vulnerable to the outcomes. I'll just remind people that look, we have coronavirus illnesses all around us, all that's around us, right? The common cold is a coronavirus, and so we're used to coronavirus. But that's not a problem. The problem is if it puts you in the hospital and kills you and does that at an excessive rate. That's the problem. So driving those numbers down, that's really what we've been focused on. And so he was very optimistic that he wouldn't see those kind of, hopefully wouldn't see those kind of surgeries and see those kind of drugs. So the answer is yes, we're very optimistic that very optimistic. Yeah, what we're seeing. So the question is, what are we seeing with the vaccinations and the uptake and the scheduling, and the people are anxious to get scheduled. So what we're seeing is just an enormous issue, which is what we're pushing for, and that's true across the board. We had seen demand changing in different counties based on those age restrictions that we had in place. One interesting note, Southern Utah, for example, was the hardest place to get a vaccine scheduled, St. George, Washington County, and that area, because they have a much older population. So we were actually moving doses and sending them down there. Now that's flipped a little bit. Now that again over 83%, now almost 70 plus have been vaccinated. They have lots of appointments available, and so this changes. So in helping fill all of that, we are seeing things being scheduled out through April, and as we get more and more vaccine, we'll make more appointments available for people. But the good news is that this has been very well received across the state. No place lagging behind right now. There are certainly some counties, if you look at the measurements, some counties have a higher percentage of the population that have been vaccinated than others. And so we're working on that. So some of that has to do with, again, the demographic makeup of the county. So Utah County is a good example of that. Utah County is one of the youngest counties in the state and in the nation. And so obviously, those under the age of 16 are eligible for vaccine. So we're going to see, as a 12% of population, a lower age rate. But nobody's lagging right now. Nobody's seeing great demand. Great demand. Yeah, so the question is around Johnson & Johnson that we were aware of this. The question is that we're in a statement that we have had some Johnson & Johnson distribution sites who had vaccine early and then didn't get the anticipated vaccine. That was not I mean, it was originally, but we were told that would happen by the White House several weeks ago. That they had 4 million that was nationwide that had already been produced. And they wanted to push that out. And then there would be a delay only about 4 million in the next 2 weeks, which we just finished up. And then now the big increases are coming. So an additional 4 to 8 million over the next 2 weeks is what we've been told, which again are huge numbers. And then we're going to see that curve just go up exponentially. And we're also seeing an increase in Pfizer this week. So those numbers are really important. Nationwide, I think it's an increase of about 60 million total. That's big numbers, and you can kind of do the math for Utah. We're approximately 1%, although we're 1% of the total population. The adult population we're actually less than about 23, because we're so young. But that gives you a little bit of a feel for what we're looking at with Johnson & Johnson. And we anticipate a lot of Johnson & Johnson coming in this week, next week, this week, next week. It will, yeah, that will absolutely, yes. So we keep telling people, even if something says they're full through April 15th, when we get every week, we get every information, and we don't know what it's going to be. They try to give us some kind of general insight. We really don't know until our call with the White House every week. We have no idea. Tuesday, the White House get on, and they say, hey, this week we're going to have this much extra. And that's when we start. Then we have to order it, and then we determine where we're going to put it, and then they open up that scheduling. So even if some place is scheduled out through April 15th now, in a couple days, they would have new doses available that day or the next day. So keep checking. Be patient. Keep looking back. But once you have one schedule, don't change your schedule. If you do find another one, you do please cancel. Don't have to open. That's where we're taking your vaccine. Thank you. One more question. Anybody have one more? I'm not seeing it. Okay. We might have one more question. Now, in advance of this, I have to warn you about the gun shortage about to happen. I will just say that every day is Labor Day in my house in Fairview, so please with the meetings and the criticism, just go easy on us. But we're really excited. I really want to thank the nurses who are here to help us out. And everyone, this is so cool. Thank you for making this happen. So, Abby, come join me, and we'll make it official. I know.
Thank you all for coming. Just a reminder, you all know this, but if you talk with anyone, please respect their privacy, respect your privacy.
Great, man. Great. This is awesome. Honestly, didn't feel it at all. So, don't worry about shots. I will say, though, it's a joke. They brought in, they did use vaccinate cows, and they put it on the back table there. They just definitely don't use that. Definitely don't use that. Good stuff. Thanks, everyone. Thanks, everyone.